We are joined now, both live on the air and on SuperTalk TV, by a pulmonary and critical care physician at Hattiesburg Clinic and Forest General Hospital.
Is this all Hattiesburg all the time now?
Yeah, baby. You got to focus on the hub city, man. Dr. Wes Aldred joins us. How you doing, Doc?
Hey, Mr. Hughes, I'm doing well. I appreciate y'all letting me come on the air, and I appreciate the Gallo Show's support of healthcare in Mississippi, around the year, even in times not of pandemic.
Have we had those? It seems like so long ago. It seems like this has been going on forever, Doctor.
Yeah, I know. I agree. I started the Hattiesburg Clinic about a year ago, so right in the middle of the pandemic. Before then, I did my training at university in Jackson. So, at this point, I feel like I've been raised during pandemic.
Yeah, well, you definitely have earned your stripes, if that's the way you started. Now, it has been a rough year, but it's changed a bit from where it was at the beginning. Last year, we didn't know much. We didn't have access to the vaccine. We didn't know where we were going or how it was going to turn out. We have a little better idea of some of that now, but we still have problems. They're just different ones. And what I wanted to talk to you about today is I keep hearing these stories, and I'm wondering if you have any personal experience with this. I keep hearing stories of people who were against getting the vaccine. Then they wind up in the hospital with COVID, and they change their mind. Have you had any experiences like that?
Unfortunately, I have, and talking to most physicians around the state, that's a fairly common theme. As you're aware, there's a lot of misinformation out there right now, a lot of misinformation on social media. People are getting advice not from the best sources, not from their physicians, not from the folks that take care of them and that have taken care of them for their whole lives. And they're turning to social media for information, and you can see the regret on their face when they come in the hospital. One of the questions we always ask when we admit folks with COVID to the hospital is if they've been vaccinated, so we can kind of keep surveillance on that. And I've yet to admit somebody to the ICU that's been vaccinated. And when I ask them about vaccine status, you can just see the regret on their face. And without fail, they'll say, "Look, if I get out of here, I'll get the vaccine as soon as I'm out."
And that, unfortunately, is a common story that can be avoided. But I'm afraid, Doctor, it's going to have to play out that way for some folks. At least that's what it seems like.
Unfortunately, so it's disappointing. I think Dr. Dobbs kind of summed it up best in a press conference last week that we didn't have to be here. It didn't have to be this way. For those of us that have kind of been dealing with this since March of 2020, the finish line for us, we thought, was getting to the vaccine, and physicians lined up by the hundreds of thousands across the nation to get those first vaccines. And we thought we were getting near the finish line. But unfortunately, after that first round of uptake of vaccination, it fell off and folks got complacent as numbers fell. And here we are as a result.
Well, one thing that I think may have tripped us up is that we allowed ourselves to be filled with hope that there was a finish line here. Let me ask you this. With this being a coronavirus, is there really a finish line to this? Because we're dealing with the Delta variant right now. We've already got the Lambda variant that people are talking about that's starting to build up around the country and has already taken hold in other countries. Is there ever an end to this?
I think that's a great question. And, it's fascinating to me in medicine that almost 18 months into this, we still have so many unanswered questions. All that we can do is control what we can control. We know that as transmission increases, the chance for mutations increases. And the best thing we can do right now to decrease transmissions is to get vaccinated. So we need to focus on the immediate goal in front of us. And, what comes later comes later. But for now, all we can do is try to increase vaccinations.
We have heard the stories from around the state with various hospitals and other medical facilities being not at capacity, beyond capacity. What can you tell us about what's going on in Hattiesburg right now?
Look, Dr. Dobbs, Dr. Byers, folks have been preaching this for weeks and weeks that healthcare was going to fail, and we're there. University just opened 2 field hospitals in a parking garage, one in ICU and one kind of more of an extended outpatient setting. And we're in talks, from what I understand, about trying to get some federal help in Hattiesburg as well. And the fact of the matter is, as of yesterday, we're a 50-bed ICU. We had 36 patients admitted with COVID. As we know, the courses with COVID-19 can last weeks and weeks. So that really gives us only about 14 beds to work with for folks that don't have COVID, that just have, a heart attack or a stroke or have had a car accident. And that's not enough to support the community. And a time is coming very, very soon where folks are gonna die of things that we could treat because we don't have space at the end.
Well, and I think that's what I was going to get at, the question I was going to ask. When you say, and we hear this a lot, that hospital care and critical care in the state is at a breaking point and it's going to break soon if things continue, what does that mean? And I think you just explained that perfectly. It will come a point to where if you have a stroke or a heart attack or something like that, there's nowhere for you to go, right?
Correct. I mean, there are things that we treat in the ICU, in normal years that are treatable and that we can save people. We can save lives, stroke care, heart attack care, serious infections. And currently, if you come in with a heart attack and have to go to an emergent heart catheterization, there may not be an ICU bed for you after that. You're going to start seeing, folks not able to actually leave the operating room and stay and be housed in an operating room setting without an ICU nurse. Folks are staying in the emergency room for long periods of time, days, before they get an ICU bed. And emergency rooms are not staffed appropriately with nursing care to cover those sorts of patients for those amount of times. And unfortunately, what happens is things get missed and people will die of things they didn't have to die from. It's not fear mongering. It's just going to be a fact.
If we get to that point, how does that work? How do you choose who to treat and who not to treat? Is it first come, first serve, or is there some other basis that you would use?
That's a really hard question. So, I told you I was at university when all this first started, and initially, we came up with resource allocation committees and essentially groups of people that would look every day at kind of all the patients that we had and what resources they were using, and you would pick who had the best likelihood of survival, and that's who you focus on. It turns almost into battlefield medicine, and that's just, God, it's just not a place where we want to be. That's not what any of us signed up for.
Now, you mentioned that you have a couple of field hospitals that have been set up in Hattiesburg. The question we always get when somebody says, "Oh, you're shaking your head."
No, the two hospitals set up in Jackson. We've requested federal assistance in Hattiesburg.
Okay, very good. But the question we always get is, well, you set those up, but there's nobody in those beds. We found out yesterday there are people in those beds in Jackson, and I would assume if you get that assistance request approved and you have a similar setup in Hattiesburg, it won't be so the beds can just sit there empty, I would assume.
No, those beds will fill up almost immediately, either as transfers from other hospitals that need to be offloaded. All the hospitals around us onto the coast are full, and they're dealing with the same issues. They have patients that are left out in the general patient rooms that need to be moved to an ICU, and those sorts of folks would be moved pretty quickly.
What's the solution to this? I mean, it's looking like at this point, because the number of cases is a leading indicator, and it can tell you how many people you're going to be dealing with in critical care in a week to 2 weeks. So the immediate future, I'm afraid, is already set. But what's the solution to this, Doctor?
So, again, Dr. Dobbs put it really well. At this point, with the transmissibility of the Delta variant, you are either going to choose to get vaccinated or choose to be infected with COVID. That's just the fact of the matter. If you get infected before you have a chance to get vaccination, your option right now is really to go and get the monoclonal antibody infusions. That's going to be your best chance to prevent hospitalization. And I strongly recommend talking to your doctor if you pop positive. But other than that, the only way out of this is to increase our vaccination rate.
Dr. Wes Aldred with Hattiesburg Clinic and Forest General Hospital. We appreciate your time, sir, and keep fighting the good fight, okay?
Thank you. I appreciate you, man.